What's up, everybody? Welcome to this week's episode of the Well Man's podcast. My name is Brian Brosey, joined by my friend and co-host, Dr. Keoni Tita. Keoni, how are you today?
I'm doing wonderful. Thanks everybody for once again listening to us. Hopefully this will help. Today we're going to talk about hemorrhoids, which is a condition that most of us will experience in our lifetime, and hopefully this podcast is going to be able to keep you away from the doctor and prevent them from even happening to you. So there are a bunch of natural treatments that can really help with this. So, and if anybody's ever experienced hemorrhoids, it can be really irritating to say and can be extremely painful depending on how they present themselves.
Yeah.
So what are hemorrhoids? Well, hemorrhoids are just the collection of veins around your anus and your rectum. You have a big venous plexus around there, and it's really interesting how our creator kind of set that up, because it's one of those things that just doesn't make a lot of engineering sense to me, but what do I know? But anyway, the because while you're standing, gravity affects that, so you can get blood pooling there. So naturally, you're going to have blood pooling in that area,
hmm
which kind of exacerbates the hemorrhoids. That's just from standing, or
Okay.
from constantly sitting. Um, and but it makes sense in this realm, is that you do want a lot of blood flow there that's constantly coming and helping with bowel function and preventing infections and all that stuff. So that does make sense. But the reason why most of us are prone to them is just because of the nature of our anatomy. The second way also is because we talked about this during the constipation podcast, Brian, is we really don't use the bathroom the way nature intended, so to speak, right?
hmm
We all of us tend to use a toilet. We sit on a toilet and our legs are not in appropriate position. I mean, our ancestors, when they had a bowel movement, they were doing a sitting squat to have their bowel movement, and that was a really good position to put the body in, and it would actually help prevent constipation and allowed stool to pass easily. And that's why, one of the greatest inventions in the world is the squatty potty. And that's a
hmm
little stool that you can put up against the toilet, and it will position your knees up towards your chest, and you're more in that sitting squat position. So that's one of the things that I recommend people who are prone to hemorrhoids at least try to do. Now, I've talked about constipation. That's one of the biggest things that can cause hemorrhoids. And it's just basically that internal pressure. So not only do you have all the blood pooling there, but you're straining at stool and putting pressure there and helping to balloon out those hemorrhoids. Because after all, what is a hemorrhoid? It's basically the ballooning out of the veins, right?
Okay.
You can see this with varicose veins. It's part of what's known as venous insufficiency, where the veins lose their integrity and balloon out based on the pressure. So
hmm
unlike arteries, veins don't have the elasticity that arteries do that help pump the blood. With veins, we have to use movement, um, breathing, and everything else
hmm
to get the blood back to the heart. So, so the veins are really easy to balloon out, and that's why you'll see as we get older, people have varicosities, spider veins, hemorrhoids are more prevalent as we get older, also because of that. So that's another big issue. Like, how can we help the integrity of these veins, keep the integrity good? And we'll talk about that when we get into some of the natural treatments.
So hemorrhoid in
Um,
itself, Keoni, is not an infection.
uh-huh.
It's just a pooling of that blood and the ballooning
Yep, it's
out
just a
of the.
balloon. It's just a ballooning out of the vein, and you can have internal hemorrhoids, which are more kind of in the rectum towards the anus, or external hemorrhoids, where you can actually see the hemorrhoid ballooning out from the sphincter,
hmm
right? And
hmm
and a lot of these hemorrhoids, internal and external, can balloon out so much that they really become problematic. And you can imagine stagnant blood also in these veins. What happens? It can thrombose. You can get clots built up there, which can be really painful.
Yeah.
um, I mean, there's people, I've had patients tell me, yeah, every time I have a bowel movement, my hemorrhoid comes out. I have to, an internal hemorrhoid comes out where it's just the vein coming out and you have to push it back up through the anus into the rectum, and it can be really, really disconcerting and very, very painful. But for most people, the hemorrhoids are just, you get this itching or irritation in your anal region. It's really uncomfortable. It's pain. You get swelling around your anus. That can be another thing. And then the other thing that you have to think about is you can get bleeding there. So hemorrhoids, sometimes you can see bright red blood on the toilet tissue or in the toilet. If you tear one, you can see a lot of blood. And over time, bleeding hemorrhoids can make one anemic. So, it's one of those things that needs to be addressed and taken care of. And then also, if you have, the integrity of the vein so compromised, also you're going to be more prone to infections too. So that's another big issue. But for the most part, hemorrhoids can be controlled and maintained with just lifestyle changes and natural remedies. There are cases where, the hemorrhoids are prolapsed so much where they're out so much and so irritating, so painful that then, some people would probably want to see a doctor about it and consider surgery.
Yeah.
One thing I do want to say is, anytime you see blood in your stool, it's always a good thing to get it checked out, because it's most likely the most common cause of blood is going to be a hemorrhoid, okay, which is not that big of a deal. It can be taken care of, even though it's very uncomfortable. But that blood can have more dire causes, like colon cancer, and you can see it there. So if you're constantly seeing that and you're not sure where it's, definitely you have to see a doctor about that, because we know, I think we talked about this on a podcast in the past, but we know that colon cancer is one of those slow-growing cancers, and man, if you catch it early, you save some life. You save somebody's life. One of those insidious cancers too, right? So there's not very telltale signs of it, and sometimes the only sign you get is some blood, right? And this is one of the reasons why doctor will, especially with men when they're like 40 now, I think it is. They used to be 50, but I think it's 40 now. We'll do, we'll recommend like a colonoscopy, or we'll do a blood stool analysis just to see if there's any blood. But for men especially, this is kind of like the main thing I think of, especially when I see anemic men. I'm thinking, well, where are they bleeding from? It probably is like a hemorrhoid, or probably, somewhere further up in the GI from, I don't know, taking excessive aspirin, which can cause GI bleeds over time. So these are things you just want to keep in your mind about what's going on. We talked about the hemorrhoids being thrombosed, and sometimes people feel like a hard, painful lump in their anus. That's one of the things. And this one, when it's thrombosed, it can be really painful and swollen. And yes, it's very disconcerting if you've never had this happen, to where you feel something come out of your anus that you're like, what the hell is that? And it just happens to be a hemorrhoid,
Yeah, it sounds
yes, you
thought-provoking.
Yeah. Oh, yeah. Right. I mean, especially if you don't know what's happened. I've had a patient be like, "What the hell?" Freaking out about that. And it's I'm just like, "Oh, it's just a hemorrhoid," And actually, you can actually push them back up inside you. One thing I don't recommend. I've had a patient do this. I mean, it's just funny how we humans are. That I felt a little lump there, and I was going to try to pop it with a needle. Don't do that. I mean, that's an area. Yeah, that's an area you don't want to do. You probably want to have a doctor do that. I mean, that just leads to all kinds of complications, even though I get what you're trying to do, but don't do surgery on yourself if you can help it.
Yeah, especially near the rectum.
Right. So what are the things besides just our anatomy and walking and the daily sitting that really causes problems? Well, straining during bowel movements is a big issue. So, if you tend to be constipated, in that definition of constipation, I include straining, not just frequency of bowel movements. I mean, typically I say people should have at least one bowel movement a day, at least. And it should be easy to pass. And there's ways to make the bowel movements easy to pass. And we'll talk about that in a second. Um, you know, sitting for long times on the toilet and straining, that's another thing, right? Being obese, you know, what doesn't obesity do for you as far as negative consequences? But being obese, think about what obesity does, right? I mean, you build up visceral fat, internal fat, that creates all kinds of pressure on your body, including downward pressure into those rectal veins and anal veins that, you know, can be known as hemorrhoids or piles.
Mm.
One of the big things, women are very well aware of this, being pregnant, right? You have you're growing a baby inside you, and that's a big space occupying mass, and that's going to put a lot of pressure below, and that can cause a, it's almost like the norm to be pregnant and have hemorrhoids. But there are ways to help with that. Regular heavy lifting. This is a big deal with lifters. I mean, I know me and you, Ryan, we love getting into the gym and stuff, but this is where when you're doing like a heavy lift or a heavy squat and stuff like that, you know, there's appropriate breathing techniques and a way to, you talked about this before, like strengthening that what do you call it, the thoracic girdle, like tightening that up around you, the muscles around your abdomen and stuff before you do like a heavy lift, like squats or deadlifts.
Yeah, you definitely. I mean, here's a great point. We can't go on without mentioning just the pelvic floor as a whole, lifting, doing that activation of lifting the pelvic bowl up and in
Right.
as you're doing these lifts. But yeah,
Yeah.
absolutely. That abdominal corset you're referring to. Just getting that good belly button sucking in and up action, bracing the core like we're going to get, punched in the gut on all ends. And then, like we mentioned, the pelvic floor, not forgetting we want to lift and elevate that pelvic floor as we're doing some of these heavier lifts.
Right. Yep. What else can do that? I think that covers the main things that can cause hemorrhoids. Any of any type of trauma to that area too, right? You know, whatever that may
Sure.
be, can also, be a cause of having hemorrhoids. The main risk factors are age, I would say, and constipation are the main As you age, the risk of hemorrhoids increases. It's just the integrity of the venous walls that just, have issue, get weaker. Right. And there's ways that you can do that. And pregnancy is a big one too that we talked about. We talked about what else? Oh, we talked about anemia. We talked about blood clots from hemorrhoids, a thrombosed hemorrhoid, but also the hemorrhoid can kind of like strangulate itself, right? So it can twist on itself to where you can cut off the blood supply. And that's also going to be extreme, excruciating pain. So those are just some of the complications. Before we get into the natural treatments, I just want to go over, there are surgical treatments for it. They should be the last resort. So a hemorrhoidectomy, right? It's basically, the doctor makes a small cut, where the issue is around the anus and slices them away. Sounds lovely, right? Give you local anesthesia. That's not the worst part about it. Basically, you have a lesion there now that, is going to be passing stool through there, which cause a lot of pain as you're healing. So, which leads to a lot of complications. It's not something you want to sign up for by any means. So that's should be your last resort. There's also something called a procedure for prolapse and hemorrhoids called PPH. It's like a stapling surgery. And it's like a stapler device where they reposition the hemorrhoids and staple it to like the wall of the rectum or whatever, and basically without basically cutting off the blood supply, and then without the blood supply they shrivel up and kind of die, if you will.
Yes, we'll definitely keep those at the last last of the list. I have seen people specifically discharged from the hospital to the skilled nursing facility just to recoup from a hemorrhoidectomy. So like you're mentioning, it is, I mean, you're going to go through a rehab process with that, certainly.
Yeah, you definitely will. This procedure where they're doing the PPH or the stapling procedure is a lot less painful, a lot less complications than the actual hemorrhoidectomy.
Okay, interesting.
Yeah,
Sounds like it'd be the opposite, just from the thought of what's going on.
I mean, it seems like all of these procedures I'm mentioning are just going to have issues with it. Just be painful. So they should be on your last resort. And then there's a ligation procedure. It's called a hemorrhoidal artery ligation, rectal anal repair. It uses like a Doppler sensor inserted into the anus, and it basically detects the artery supplying blood to the hemorrhoids. And from there, they kind of tie off the hemorrhoids, and of course, they kind of tie off the artery hemorrhoid junction, so to speak. And I don't want to confuse people, because hemorrhoids are veins, but there are arteries that are attached to those veins.
Yeah, the blood's got to get there somehow.
Yeah, right. So anyway, they'll help tie that off where the hemorrhoid is not constantly fed with blood and ballooning out and causing problems. Again, it's this procedure's virtually painless for the most part. There are some complications, but much better than the first thing we mentioned. It basically ties off the blood supply, and within a week they're no longer noticeable at all. So that's the last resort thing that I would even recommend to my patients. And sometimes you want to do that. I mean, they grade these hemorrhoids from like grade 1 to grade 4. Grade 4 being like completely prolapsed, an internal hemorrhoid completely prolapsed outside the anus, and it's difficult to push back in or whatever. It's like it needs surgery. That's so rare with that. And I haven't seen one of my patients have to deal with that. Mm-hmm. And most doctors now are pretty keen on like, well, let's just try like some of the natural approaches. So what are the natural approaches? Like what can we do?
Well, so I also want to ask you, Keoni, before we get into that, just as far as conventional versus natural, it seems like, we talked about 2 conventional treatments, and the second one, PPP or whatever it was, the stapling procedure.
Yeah, the stapling PPH, yeah.
That one seemed to be about stopping the blood supply, like you mentioned, stop feeding the hemorrhoid. As far as natural versus conventional, what is the general, rule of thumb here? Do we want to feed more clean blood in to help kind of clear out this area and stop the stagnation, or do we want to drop the blood supply so we can decrease that inflammation going around down there before we restore normal blood supply? Does that make sense? Kind of what is our actual mode of attack here?
So no, it's a great question, because naturally what we're trying to do, all right, and you can do this even if you're going the surgery route with these, you are trying to do lifestyle modification that can include like, appropriate, like not straining, all that stuff, making sure you're getting appropriate fiber, making sure that the bowel movements are such that they're easy to pass. You want to make sure people are exercising help prevent hemorrhoids also. Again, it's about increasing blood flow and decreasing it, like getting blood in, getting blood out to keep the veins healthy so the blood doesn't pool. When the blood pools, it will balloon out, especially in veins. And there's certain fibers that I really like. One of them is called acacia. Another one is called psyllium. I use them for different things. I'll talk about that in a minute. The other thing that you do is you want to help give medicines that help maintain the integrity of the veins. Okay. And there's a number of things that can do that, which I'll talk about in a minute. And then there are, kind of like management things that you can do naturally. Everybody's seen this stuff, right? Witch hazel, topical witch hazel on it to help with the irritation and burning. But that's more management, not really getting to the cause of what's going on. So you can do all of those things, even if some of these prolapse hemorrhoids are really a problem. And that's where surgery comes into a problem. Like that's where surgery would be recommended. Like if the hemorrhoid is so painful and it's constantly prolapsed and just, affecting your quality of life, and you've tried everything that we're talking about in this podcast, then absolutely I recommend surgery. But you can do everything we're talking about to help prevent them. When you do surgery, right, it doesn't mean the hemorrhoids won't come back. They can come back somewhere else, and they probably will if you don't take care of the natural stuff that we're talking about first.
Right, absolutely.
All right. Does that get to what you're kind of asking?
Yeah, definitely with the lifestyle, it makes sense. And then you see with conventional that it's more so, and I mean, we see this with conventional, obviously, it's not so much lifestyle or management. It is management of the sign and symptom or the actual thing that's going on versus really trying to get to the root cause and solve that problem.
Right. Well, I tell people, like, if you've dealt with hemorrhoids and you haven't done some of the natural things that can really help, that's the first thing,
Mm-hmm.
to do. And so let's get into the details of that. One thing about hemorrhoids and GI stuff is you'll hear a lot of people say, well, you should increase your fiber, right? And I absolutely agree with that. Definitely increase your fiber. But fiber without water will constipate you and can make the hemorrhoids worse. I really like a soluble fiber called acacia fiber for it. And that's what I tend to recommend. You don't really see acacia over the counter, even though conventionally doctors will recommend fiber like Metamucil, or I forget the ones they have. I mean, they're like flavored and they have sugar or whatever in them. I mean, I just don't like them. I mean, they just seem very, very synthetic to me, and plus most of them are psyllium based, and psyllium is an insoluble fiber, which can be very irritating, especially if you have GI complaints further up, like IBS or irritable bowel, or if you have diarrhea constantly, just gonna be irritating. However, if it's not, I recommend doing a mix of acacia fiber. So acacia fiber would be the first one, and then probably mixing it either with psyllium or doing like some acacia on one day, maybe some psyllium fiber on the next day. That's soluble and insoluble fiber. Both those fibers have benefit. On our fiber podcast, we talked about the differences of those. So fiber is a big deal, but make sure you're well hydrated with those. It can certainly help. On our constipation podcast, we talked about that can help with constipation, right? We talked about tincture of bitters, that stimulate the bowels. This is why a lot of people like their coffee in the morning, so they can have their morning bowel movement. That's probably the most bitter thing that most Americans eat. But bitter greens, and there's tincture of bitters that can help, that you can get, an old timey remedy for constipation. It just stimulates the bowels. Also, making sure you're getting enough fat in your diet. I call that lubricating the bowels. With the grease, helping things slide through easily.
Right.
Exercise, of course, is another one. So how about venous integrity? So the veins are these that really, really are filled with compounds called glucosaminoglycans, and they just help with the integrity of the vein. And one of the supplements I use is called, there's a number of them out there that are glucosaminoglycans. I mean, collagen could even fall under this, but there's a compound, it's called mesoglycan by Euromedica. I use that. It's a glucosaminoglycan. It's basically made to help strengthen the wall. There's bioflavonoids can also strengthen the venous wall. There's a specific one for veins called diosmin, diosmin. It's found in a lot of fruits and vegetables, and it's concentrated in pill form. You're taking a pill form that can certainly help the integrity. Rutin, hesperidin, all these bioflavonoids in the natural diet, which, by the way, of course, I'm implying like a high fruit vegetable diet certainly helps with preventing hemorrhoids. Mainly because of the fiber, also probably because of these compounds in there. I use something like a solitary extract. It's a high concentration of, like, I don't know, 100 times of berry extracts, blueberries, raspberries. Is actually quite delicious. But that's a great thing for the vein. It's interesting how this kind of fits doctrine of signatures. Doctrine of signatures being how the old timey medicine men used to help figure out what medicine was good for you, right? So anything was blue would be good for the blue veins, the walnut looks like a brain, so eat walnuts for your brain, that type of thing. So, yeah. But anyway, so dark colored berries help the veins. And this is shown in science. If you want to get to my more woo-woo edge of some things that can help, there are some homeopathic remedies that you certainly can try. Colosonium canadensis, this is an herb that's a homeopathic that I've used, and some people, whether it's placebo or not, certainly like it. I certainly wouldn't give the homeopathic remedy without going through all the other stuff that I mentioned first. But right. Speaking of that remedy, and there's a number of homeopathic remedies out there that you can certainly try. But speaking of that remedy, I will use herb or tincture of herbs that have like herbs that are very good in treating hemorrhoids internally. Okay. And what are those? That's going to be colosonium. So I use that. There's a product it's called, I forget the company. I think it's Herb Farm. They have something called Vein Health, and it has colosonium in there. It has gotu kola and horse chestnut in it that you can take internally. And it can help with not only varicosities, but definitely hemorrhoids, but also spider veins. It just helps with the integrity of the veins. I would be remiss without talking about some other treatments that you can do as far as just managing the symptoms. One of them is hydrotherapy. So a sitz bath, right? Where you sit in a bath and it just basically the water covers your pelvis. You kind of, your legs are out and you're sitting up, but it's basically your the whole pelvic girdle's in water, and you can put magnesium, Epsom salts there, and then you can also put witch hazel in there. Witch hazel, by the way, you've seen, all the witch hazel products that you can find at any drugstore here, anywhere. That is great management for hemorrhoids because it has a cooling, astringent effect. So it helps with the symptoms of itching and irritation.
Right. Okay. Is that what's in most topicals, Keoni, or no? The over the
yeah, that's what's in most topicals. Like one of the things that you'll see, you see at drugstore like Tufts hemorrhoid pads, Tucks, Tucks hemorrhoid pads and cream. Yeah, it's witch hazel's the main active ingredient in that. So you can find stuff over the counter that's using witch hazel quite a bit.
And when you're recommending it for a client, how are they doing an over the counter that has witch hazel in it, or do you have are you able to access 100% grade witch hazel or whatever it may be?
Yeah, I certainly can. I will give it to them in our clinic, or I'll just tell them like, you can go getting the stuff at the drugstore is just as good too. I mean, I have no issue with that. But yeah, I can get them an herbal tincture or herbal bottle of witch hazel that's, I know where it's come from. But the witch hazel over the counter at the drugstores are fine. They may have some extra ingredients in there, but they're going to work as well.
Okay.
In my clinical experience. What else? Oh, for another thing which I haven't used that much, but I just lost my train of thought. Let's see. Oh, it's vitamin E suppositories. So for internal hemorrhoids that are being problematic, like some of the vitamin E suppositories can alleviate itching and discomfort too. So that's another thing that you certainly can try. But again, these are all, like symptom management. But one of my favorite things, and again, I'm going into Chinese medicine here. From a Chinese perspective, anytime you have a prolapse of anything, whether it's the uterus, whether it's the bladder, whatever it is, in Chinese medicine, it's going to be diagnosed or called spleen qi sinking. And there is a wonderful Chinese formula specifically for that. That's very common. That's about 3,000 to 4,000 years old. And it's called Buzhong Ichi Wang. So I'm going to just spell this out for you. So it's Bu, Bu, Zhong, Zhong, Yi, Yi, Qi, Qi, and then depending on the formulation, it could be Wang or Tong or whatever, but Buzhong Ichi Wan. It's a great form of sinking. Anything that has to do with GI stress or anything like that, it's a great one. But what it does is it tonifies. And I know this is going to mean a lot to people out there, unless you're kind of versed in Chinese medicine, but it just tonifies the, how should I say, the digestive qi, of the organs. It just helps alleviate the symptoms. And if I had to say, if there's any one thing that gets to the root cause of hemorrhoids, that formula would do it. All right. So I generally use that with, the stuff that I talked about, the flavonoid supplements, the Heisman, the hesperidin, rutin, vitamin C plays a role in there, zinc, foods rich in flavonoids, along with a vein tonic type tincture of herbs, and then this Buzhong Ichi Wang.
And that root cause, just to be clear, is the stagnation down there. Is that
correct? Yeah. It's a stagnation and the prolapse, the prolapse where the veins are ballooning out. So Buzhong Ichi Wang could even be used for varicose veins in the legs, or even spider veins to help with that. But for hemorrhoids, it's kind of at least for me, it's kind of the go-to formula. Especially if they fit the symptom picture, and and the clinical signs and symptoms of everything, then I tend to use that one. I also do acupuncture too. There's specific points that can help. One is stomach 36, which is on the anterior lower leg. And then I use what's called points UB57, UB58. These probably don't mean anything to anybody, but to acupuncturists, they certainly do. And that's on the back of the calves, which can help with spleen qi, raising the qi so that the veins no longer balloon out. So I think that's everything that I wanted to go over with that. I mean, is there anything else, Bryan, that you can think of people would want to know about?
Not that I'm an expert here, but just obviously going back to the lifestyle stuff of consistent walking, turning on that pelvic floor, like you mentioned, kind of setting up for a proper bowel movement, all those things playing a huge role. But getting up, walking, squeezing on your butt together if you're forced to sit for a while.
Which means like avoiding sitting for a while, right? Getting up and moving.
Yeah, absolutely.
Yeah, those things, I mean, really, when we're talking about root cause, I mean, those things are primary.
Seem to come back around every time.
No doubt. Anyway, I hope that helped. I hope that helped everybody out there. If you have any questions, let us know. If you think this is helpful, please tell your friends. Thank you for listening once again.
Yep. And until next week, we will talk with you next week. Be well.
Be well. Thanks.